Today, we are going to talk about toxic shock syndrome, which is caused by Staphylococcus aureus. Staphylococcus aureus is a gram-positive, coccus-shaped, facultative anaerobe bacteria. In anaerobic conditions, it grows using lactic acid fermentation. It can use oxygen, nitrite, or nitrate as electron acceptors in the electron transport chain. It is also known as a mesophile. The cells replicate every 1 to 3 hours on average through binary fission. The disease toxic shock syndrome is characterized by a sudden development of high fever, headache, muscle aches, bloodshot eyes, vomiting, diarrhea, rash, and confusion. After about a week, the skin can begin to peel. If you do not receive treatment, it can lead to death because of hypotension, which leads to organ failure and coma. Women typically start to experience symptoms 3 to 5 days after the use of tampons. If surgery causes the infection, symptoms can appear as quickly as 12 hours post-operation. Staphylococcus aureus is a normal part of our microbiota, usually residing on the skin, but can cause substantial harm if it enters the body via cuts or wounds. Often, prosthetic devices such as central venous catheters or menstrual products such as tampons or menstrual cups allow this microbe direct access to our bloodstream. As Staphylococcus aureus colonizes the bloodstream, it is also able to invade the skin and soft tissue. Virulence factors. 1. Exotoxins. A variety of exotoxins such as alpha-hemolysin, beta-hemolysin, and Panton-Valentine leukocidin insert themselves in the cell's plasma membrane and form a hole, leading to lysis of the cell. This leads to a fever in the patient. Number 2, adherence. Staphylococcus aureus covalently attaches to peptidoglycan in the host cell's membrane. Adhesion is facilitated by MSCR8-MM. This allows for quick spread throughout the host body. What is it? S. aureus?
Yes.
Number 3, avoiding destruction by phagocytes. It secretes 16-kD extracellular fibrinogen, which binds to plasma proteins and tricks the phagocytes into uptaking and clearing the phagocytic cells instead of destroying them. This can lead to a continued infection and more severe symptoms such as organ failure. Toxic shock syndrome, also known as TSS, is a complication of infection that is not transmittable. However, the microbe Staphylococcus aureus that causes TSS can be transmitted from person to person through direct contact. TSS has become very rare and is sporadic, with the incidence between 0.8 to 3.4 per 100,000 in the U.S. The main reservoir for Staphylococcus aureus is humans. The portal of exit can be through hands, bodily fluids, or fecal matter. Transmission is through direct contact, hand-to-hand, fecal-oral, or sexual contact. The portal of entry can be through hands, blood, skin, surgical wounds, digestive tract, and surgical devices. Susceptible hosts are usually women who use tampons, especially after childbirth or surgery. There are 2 antibiotics to treat TSS. Vancomycin inhibits cell wall synthesis by binding to the amino acid chain of NAM molecules, preventing them from forming crosslinks. Daptomycin is a bactericidal antibiotic that damages the cell membrane. There is currently no vaccine available for toxic shock syndrome.
And then
Some human behaviors that can reduce transmission are proper use of tampons, which is washing hands before and after application, lowest practical absorbency of tampons, and changing them frequently, which is typically every 4 to 8 hours. We can also wash our hands, keep surgical incisions clean, use pads instead of tampons, and if you have had TSS, avoid using tampons in the future.
there you go.